Hi, everybody. Welcome back to the Human Happy Hour podcast with your hosts, Jason Argento and Rena Goldman. And today's guest is Cherie Troyen. She has a master's in education and counseling and school psychology, a postgraduate training in marriage and family therapy, is certified in hypnosis, and is an approved consultant for the American Society of Clinical Hypnosis. Cherie is a licensed clinical mental health counselor who uses a blend of therapeutic techniques, including EMDR therapy and clinical hypnosis. So welcome. Glad to have you with us, Cherie.
Glad to be here.
Okay, so I probably should mention that Cherie's my therapist. The first thing, and I never get to ask you questions much.
That's true. I asked you questions.
What inspired you to get into your line of work?
Many life experiences, but one stands out in particular. I was skiing with my husband many years ago before I had kids. They're grown now. And we were out west or somewhere. We were on the lift, on the ski lift, and it was very, very high off the ground. And I was adjusting something very stupidly, not paying attention, just adjusting this and that, and slid actually off the lift to the point where I was holding onto the safety bar with my hands.
Oh, and terrifying.
Yeah. And one leg just with my knee hanging over that little footrest, one knee, the rest of me hanging, and it was a blizzard. And it takes about 5 minutes or so to get to the top on a lift. However, because I was hanging, I think that the authorities decided that they would be less liable for a lawsuit if I fell if they were not moving. And so they stopped the lift. And so I am hanging there in a blizzard, and I'm not going anywhere. I'm hanging. And I had no idea how long it would be, how they would get me down. But they stopped the lift. So I said to my husband, Mitch, I'm going to sleep now. Put your hands on my hands. Of course, we're both wearing mittens. Put your hands over my hands and wake me up if you feel me slipping. And then I said to myself, and this is another strange one because I've always considered myself an atheist. And in that moment, I said, please, God, help me hold on. And from that moment until I actually was awakened by the sound of the chain that they were lowering me on, I have no idea where I was during that time. But people afterward told me it was an hour that the lift was stopped. So I was hanging there for an hour.
Wow.
With absolutely no recollection of where I was for that hour.
Wow.
I took a lunch break and went back out like nothing had happened.
Oh my God.
And then I was on a gondola and people were saying, oh my God, did you see that woman hanging from the lift? And one of them actually said, oh, what a pain in the ass. We had to wait a whole hour. And I looked and I said, did you happen to notice what she was wearing? And they said, no. I said, she was wearing this. I couldn't resist. But that was one of the experiences that caused me to want to seek formal training in hypnosis. I also hate having a numb mouth when I get dental work. If you get a filling and it doesn't fit right, you don't know when you leave the office if you're numb. I don't like it. And so when I would go to a dental office, I would say, I don't want any shots. And I would just kind of put myself out of that sensation. I had an implant. I've had root canal. When I had an implant, I said to the guy, just wake me up when you're done. I don't want any shots. And it was fine.
Rena's face.
Yeah, I'm shocked. I've never heard anything like this.
Oh, and I do use hypnosis for pain to help people who are having a great deal of trouble with pain. And I actually have had a couple of back surgery. Well, one back surgery at many levels, and both hips replaced. And I remember prior to my back surgery, at this point, I was already involved in hypnosis. But prior to the surgery, I had colleagues make tapes for me, and I used it, hypnotic suggestion to have less swelling and bleeding. And when the surgeon saw me the next day, he said, I can't believe this, but I can release you today. He said, I have never done this complicated a surgery and not had the person have to stay overnight for draining. He said, but there was just no swelling, no extra bleeding. And that was part of the hypnotic suggestion. And I just did that for my girlfriend's daughter. And she also had a great healing experience as a result. So, and it's funny because she owns all these businesses. I said, you're used to being the boss in your company, but don't forget you're the boss of your body. And so as a result of my personal experiences with dentistry, with that ski lift, I knew that I was putting myself under some kind of hypnosis. And I knew about clinical hypnosis. I'd heard about Milton Erickson's work. For anyone who's not familiar with it, he's considered the father of modern hypnosis. And his work, I'd seen examples of it, was amazing.
Yes, I was in therapy with someone that supposedly, I won't say names, of course, that was specialized in ADHD, but because I was late for a few appointments, she told me I couldn't come anymore. And I thought to myself, shouldn't you be more tolerant to this?
Well, it's funny that you mentioned that. As you know, that's one of my specialties as well. My son has ADHD. My brother had it. I'm pretty sure my father had it. I have traces of it in some ways, but one of the things is that's part of the problem. And when my son had attended therapy for a while and missed appointments, he had the same experience. So the therapist said, you're missing appointments. I can't keep you. Whereas when I have ADHD clients, I say to them, if you remember your appointment, please text me so I don't have to text you to remind you, because it's easier if I don't have to text you.
Yeah.
But
makes sense.
I know how that goes. And if I forget to text and an ADHD person misses their appointment, I call them. I say, well, they have time now. If not, I don't make a thing of it because that's why they're coming to see me.
Yeah. I've always felt super comfortable with that. And it's made me more cognizant of the appointment, because I think part of ADHD, stress triggers it more. Like you avoid it. What's that avoidance issue? I can't remember the terminology, but like I've thought about, I might have like something avoidance, something
approach avoidance.
Yeah, that's it. Yeah. Where like if something is remotely not something I immediately want to do, or I'm super excited, I will push it way off so much so it's almost out of my life, and until it's an emergency, and then I'll take care of
it. That brings me back to therapy. Whether it's hypnosis or other therapy, when I work, I can be direct in terms of getting to the issues. But sometimes if a person has an appointment scheduled, they've had a day at work that they just don't want to do the therapy work. And I remember I had this guy that I would schedule at the very end of the day because he would either cancel or no show at the last minute. Well, rather than judge him that he's doing this, I put him at the end of the day so it wouldn't interrupt my day if he didn't show up. But then I said to him, let's call him Joe, first name I come up with, but one of my son's names. If you don't want to talk about X, just tell me when you come in. You don't have to avoid coming. Mm-hmm. And that changed everything. He was then able to come and say, I'm not up for delving into my issues today.
Yeah.
And that's what I see therapy as being. And if I'm working with a teenager, maybe has social issues, and they get invited somewhere, but the parents are going to make them come to see me, I say, no. It's most important that, you know, they're developing their social comfort. Let them enjoy that. I understand. But everybody works differently. That's my personality.
Yeah. What were you going to say when I went off on a tangent? Sorry.
You went on about your ADHD, but yeah. I was going to ask you about your experience with hypnosis.
My experience with hypnosis. Okay. Yeah. Well, the amazing thing about when we did it was, first of all, I think you knew that I was a super scientific-y skeptical person, so you didn't really use the word hypnosis. I remember looking back, and I think you thought of you called it, you know, let's relax and meditate or something. It was just it wasn't deceitful. It was just,
and I'll be happy to talk about that later and how I introduce it. But
yeah,
go ahead.
Yeah, and I remember, first of all, I remember the first time I had unbelievable back pain, because it was right around the time when I wasn't sure if my business was going to survive and stuff, and I didn't know that was the reason, but through that, I walked in your office with back pain that had been there for, like, I don't know, half a year or something. It's some ridiculous amount of time, and I got in my car and I was just like, where's that pain? And it never came back.
Oh my God.
And we didn't even talk about back pain. It was just whatever relaxation stuff we went through chilled me out somehow. And then and that led me to a time where when we did it, I would go into hypnosis, and then we would talk about childhood traumas. And I remember you telling me to have my my present self go back and be supportive to my childhood self, because I had this awful, my dad was mentally abusive, and when we would fish, he would make me it was terrifying to fish with my dad, because one mistake and you would get screamed at. And I remember you having my future self tell me some things, and I remember I was going to come up with some things, and I said things like, you're okay, da da da. And then I remember you saying, someday you're going to be a business owner. Like, myself is telling my younger self, you're going to be married, you're going to be a singer in a band, like all these things to tell my past self that this is not that important right now, or to put it in perspective. And it made, to this day, when I think of that, and I remember crying, because I was obviously lacking adult support when I was a kid. And to this day, if I think about that fishing trip, I cannot think of it any other way but having my father, me, and me there. It's just, we're all there.
Yeah. It's called a rescue technique, when you bring your adult self back to your younger self. And that was a technique I learned from Maureen Turner. She is a therapist in Burlington. And I use that technique a lot. And I do have to make a comment about what you said, Jason, because you said, I said that you will be. I don't know how accurate that is. That's how you remember it, but it came from you, not from me.
Okay.
And that brings me to a really important point about hypnosis and differences. Some hypnosis and some people who practice hypnosis are very directive. They, in that they assess what the problem may be, and they direct the hypnosis to deal with the problem. I am more Ericksonian in my style. He was more client-centered in having the belief that it is the person themselves that has the answer. And I've always believed that. And so you may remember it as my saying that. What I probably did was quiet your conscious mind enough to allow the wisdom and knowledge of your subconscious to come forward without all of the censors of the conscious mind. What do people think of me? What, all the messages we get that are not necessarily part of how we really feel inside. And so my technique and how I explain hypnosis is to get into a trance, into a state of relaxation, so that your conscious mind is quiet and your subconscious mind can come out and give you the answers. And then the way I would explain it to you, Rena, or anybody who is really a newbie about hypnosis is, and I'm going to ask you this, Rena, have you ever seen a movie and you see this actor and you know the name of the actor, but for the life of you, you can't remember the actor's name?
Yeah.
And 3 days later, you're not thinking about the actor or the movie, and the name pops into your mind. Has that ever happened?
Yeah.
Okay. What's that about? Well, you had given your conscious mind a problem to solve. What's the name of the actor? Your conscious mind then went off to all the other things of the day and completely forgot about the actor. But your subconscious was still working on it. So if something as insignificant as the name of an actor in a movie can be occupying your subconscious, think of the effect of your life experiences and your emotions. Think of how they may be in your subconscious and affecting your everyday life, which brings me to the next part of my introduction when I work with people who are new to hypnosis. And this is not something you learn. This is my way of making up how I'm going to introduce it. Everybody has to do their own style. And so, have you ever had a situation where you feel like you totally overreacted? Like, why did I react that way? It wasn't such a big deal. Rena, has that ever happened to you?
Yeah.
She always thinks she acted appropriately.
Well, in many situations, what it comes from is the current situation triggers an old memory that was not completely processed, and your reaction is not just to what just happened. You are reacting to what has been triggered from years ago. And we all know that we don't always have the time, the personal resources, the ability to process something exactly when and how it happens. And so we tuck it away like it's in a cocoon. But it doesn't go away, it just doesn't get processed, but it still gets triggered. And part of my work, whether it's EMDR or hypnotherapy, is to be in a safe situation when a person trusts me, to be able to quiet their conscious mind and allow them access. And I ask them before we start sometimes, if you have a specific thing that you want to work on, how much do you want to be able to remember, and how much do you want to tuck away into a trunk and not open up today? Because you don't want to do more than a person is ready for. Jason was very brave and he was ready to deal with everything. And I do want to mention that self-hypnosis is one of my goals for people, so that just as I use hypnosis for myself to help me get into a state where I can deal with what's coming, Jason and I have talked through the years, and Jason, you've told me of many of the experiences where you've used hypnosis on yourself, your self-hypnosis, to get through certain things. And that's part of the goal too, to teach people how to get there, because it's a skill that you have to learn, and some people are more natural. Jason was a very talented student in being able to put himself into trance. It takes other people a little more time. And it's interesting that you mentioned about the scientific type, that if I had used hypnosis, your guard might have gone right up before you had a chance to experience it.
Yeah, the guard is a big deal. It's a huge
I know,
deal.
which is why I explain it, Rena, like what I explained to you about the actor in a movie and about the overreacting and the conscious and subconscious mind. Like for you, I don't know what your experience with hypnosis is, but did that demystify it a little bit for you? I mean, I'm not in control, you are.
Yeah, I mean, I have a background in health journalism, so I haven't covered hypnosis specifically, but these things make sense to me. I think when I think about it the way you just put it, it makes me think of dreaming, right? Because dreaming is your subconscious mind trying to work things out. So I mean that it sort of clicked in that way. But who might be a good candidate? How do you determine, is it something you do with anybody, or are there certain patients with certain conditions who might?
I think it depends on what the presenting problem is. But I believe that in many cases, the client themselves has the answer, they just don't have access to it. And when I work with hypnosis, you are in complete control. And if I'm doing hypnosis or EMDR, I start with a preparation in advance. Just say stop if you want to stop. It never happens with hypnosis. It's a little less directive than the way I do EMDR. With EMDR, I do but today's talk is not about that. I could go into all of the intricacies, but I will say that both techniques use the separation of left and right brain. And that's what's so exciting about hypnosis, because many times the person themselves has the answer. I'll ask them, can you go back to when you first remember feeling this? And I do that with EMDR as well. And when you get back to that and quiet the conscious mind, and the person can go back to that point in time and the surrounding incidents, they have a better understanding. But what I'll point out is, before I ever go back in time with a person and get them to hypnosis or EMDR, I always check and make sure that they have the current resources to deal with what comes up in my office. Because if they don't, we have to build that in so that they do have the resources. Like with what you, Jason, mentioned, your current adult self was able to be there with you because your current adult self has the resources. Not every adult has the resources. And so I make sure of that before I begin that work. So you ask, who's a good candidate? I need to know their support group, whether it's their own self or friends, relatives, even an imaginary character that they can imagine themselves having. I have them specifically state the characteristics that make this person someone who would be able to deal with these things. And can you imagine them with you? And can you feel them helping to give you those characteristics?
If I'd never met you and I'd never seen anything to do with it, never had any experience with it, I would be thinking, because I know my old self, that wasn't aware of it actually being something that exists and is real, of how I would be thinking, oh yeah, there's some people talking about stuff, and who knows what if they're telling the truth or whatever. Because they don't believe in hypnosis because they have a reason to not believe it, because they've seen like maybe one of those shows, which
Stage hypnosis, yes,
yeah,
that does give people a false impression of what hypnosis is really about.
yeah,
And I'll briefly talk about that. In stage hypnosis, have you noticed they choose people to stay up and people to sit down and not be part of it? That's because with stage hypnosis, they are separating the people who really want to lose control and be up there and be that person. And those who don't are the ones who they have sit down again.
Yeah.
Because they do have you quack like a duck, but the person who lends themselves to being up for that gets chosen. That never happens in real life hypnosis, that complete loss of.
Yeah.
Just wanted to mention that.
No, and that's the difference. That helped me a lot, because that's what I would have gone into it thinking, like, because I had been to a show before and I was just like, there's something not real about this.
Yeah.
It's just, but the strange thing about that is when I went to that show, I went with a friend who's he was very conservative, very closed up, like all kinds of, I would have never dreamed that he would have done what he did up there, which tells me he had some things he was suppressing. But like, and when they go do the thing where they're trying to hypnotize you and they say, if you don't want to be hypnotized, don't look at the light or whatever it is they're going to do. He rose his hand when they said, I want you to raise your hand. And he rose his hand, and I'm just like, what's he doing? And then he went up there, and this very military, conservative, very, very closed person had an orgasm on stage. He like he pretended he thought he was cold. He thought he was naked. Like all kinds of stuff. And I'm like, who is this person? That I've never seen him be like this.
What a nice vacation from your armored self.
I guess so. And that made me go, is there something to this? Because I would never thought of him to do that if it were someone, if you're a person that's willing to do it. Like, I don't think anyone in the world right now anyway could hypnotize Rena.
He wanted permission. And to answer that, when a person doesn't want to do direct hypnosis, I won't do hypnosis and sneak it in, because that doesn't seem honest.
All right.
But I will talk about trance, and if they're open to allowing their conscious mind to quiet and be open to what's there subconsciously. And Rena, if I had given you the suggestion about your subconscious and remembering the actor's name and overreacting and saying to you, okay, so you always feel very anxious when you're going to get on a plane. Do you want to explore that with your subconscious mind a little bit? And go into,
so that's how you would start with somebody.
Yes. And I'm a little bit less shy about using the word hypnosis than I was when I started. But I mean, when I first experienced it, when you asked me what got me into it, it wasn't hypnosis. It was going into a trance to change the current reality to make it more comfortable. Mm-hmm. And really, if we look at the actual diagnosis of multiple personality disorder, or what's it called now? The word escaped me, but basically what's that about? That's about is when someone is young, or for whatever reason, they do not have the ability or the resources to escape a terrible situation, like my hanging from a chairlift, or someone else being in a situation, maybe somebody is threatening their life or something, and they, if it's happening repeatedly, to someone, they dissociate. Dissociative identity disorder is
That's right. That's
Yeah.
what it's called.
Now, that becomes their way of coping in the moment. It becomes a problem when they no longer have control over deciding when to dissociate or when not to. But we all dissociate in our lives at times. Have you ever been driving along and you completely passed your exit? Your brain was elsewhere, right?
Yeah, oh yeah, I've done it. I don't know. Have you done that, Rena?
I haven't driven in years.
Well,
So
Okay. Well, that's part of being in trance and you're not even aware of it. But obviously, if your conscious mind was paying attention, you wouldn't have passed your exit.
Mhm.
And so we've all had experience of being in trance. The difference between a pathological situation, such as dissociative identity disorder, and a person using trance to their advantage to avoid a situation is personal choice, and it's an appropriate coping mechanism for the situation.
So I don't know if you can help me with this because it's such a weird phenomenon that I don't understand. I'll be watching a video of something, and sometimes it'll be like when I'm laying down trying to, I'm not really watching, listening, because I don't like to watch it. When I'm trying to go to sleep, I'll just be listening. And I'll find myself talking to myself about something completely different inside my mind. And I think to myself, I've been doing it for like maybe 3-4 minutes. I've missed a lot of the thing that I've been listening to, and I'll try to rewind it, and I'll realize that only a couple seconds have gone by. and I haven't actually missed anything, but my little conversation I had seemed really long. And I don't know if that's like almost like a dream, or if you can explain that at all, because it's been bugging me.
That sounds like daydreaming. And what is daydreaming? That's getting into a trance.
Yeah.
And it's interesting that you mentioned talking to yourself, because I kind of developed this protocol for dealing with anxiety with talking to yourself. And I discovered that I had fallen from a ladder, had a very severe head injury, and as a result, I wasn't allowed to do anything where I had to use balance for a year. Wasn't allowed to ride a bike. When I got back on my bike, I was afraid to turn because I was afraid I would fall. Which, if I'm biking alone, fine, I can go straight, but I'm ready, make a slow turn. But if I was biking with anybody else and they changed direction, what could I do? Well, what I discovered is I would say out loud to myself, Cherie, turn now. I would command myself out loud, and that would help me turn. And I realized the power of saying something out loud. And so basically, when I work with a person with anxiety, I utilize hypnosis, and I create distance between the feeling of anxiety and the person, because many times when people are anxious, it feels like it's enveloping them. It feels like it defines them. Not, I am feeling and I'm feeling this, but I am anxious.
Mhm.
And it feels big, and it feels like part of them. And so I have them talk to it. I notice that you're here. And I even have them give it a nickname. And speaking to it, and that helps to create a distance between the sense of self and the feeling of anxiety. And I actually utilize The Wizard of Oz because so many people are familiar with that movie. Are both of you familiar with the movie?
Oh yeah.
Mhm.
And do you remember there's this powerful, mysterious thing that at the end of the movie they discover it's just this little man behind a curtain. Do you remember that?
Yeah.
Well, I kind of relate that to anxiety, that big, mysterious, all-powerful thing. But picture the Wizard of Oz, and basically, often anxiety comes from what I call negative what if fantasies.
Yes.
People will say, what if this and what if that? All made up, all fantasies. And so I call it the negative what if fantasies. And I have them picture the Wizard of Oz, or they can come up with their own thing that's sitting there on their shoulder, saying all that, and say, okay, can you come up, since we're dealing with fantasies, can we come up with a positive what if fantasy? And I play with that to help teach people that that's just a fantasy. And then I talk about brain habits. And I'm going to give you an example of a brain habit right now. When you brush your teeth, where do you start?
I couldn't tell you.
But I'm betting you probably start in the same place every time.
Maybe.
Perhaps.
Which sock or shoe do you put on first? Left or right? Do you even know?
I don't know.
These are examples of brain habits. You don't even need to think about it, but your brain just does it.
Mm.
So if you imagine a pasture, just grass, every day you walk in the very same spot from the top to the bottom. Eventually there will be a path. The grass will die from your constant walking. When it rains, it'll trickle down that area. And then there will be a path. And so instead of walking willy-nilly wherever you want, without thinking, you'll go down the path. And that's what your brain does when you brush your teeth or put on your shoes or do a habitual thing. That's an example of a brain habit. Well, an anxious brain has the habit oftentimes of going to negative what if fantasies. That is a brain habit. So I tell people, well, why don't you practice being aware of your brain habits by changing where in your mouth you brush your teeth, so that every time you brush, you have to stop and say, oh, I'm changing.
Mm-hmm.
And then realize, why am I doing this? Because I'm changing the brain habit of going immediately to a negative what if fantasy, and working on that and being aware of what they're doing and why they become anxious.
Yeah.
So that's
I do that actually with a lot of things. I'll notice that I do something the same way every time automatically, and I'll think to myself, I'm going to just not do it that exact same way anymore, almost to like challenge myself to experience it different. It sounds ridiculous now I'm saying it out loud, but that's exactly what it feels like. Simple things, and when I was a kid, I used to never step on cracks. And then I decided I was going to step on every one to defy that. I realized that was a problem. So then I would step on every other one. And I realized, and then eventually now I don't even think about cracks. It's like I explored all the options.
Well, some people are more curious about the way their brain works and about having control.
Yeah.
And sounds like you're one of those people. And that's great. And the fact is, we all have much more control than we realize. And there's a guy, he died recently, Dabney Ewan, and he did a lot of work with burns and getting people into hypnosis immediately after a severe burn.
Wow.
Can help the burn from progressing to, let's say, a second degree to a third degree or a fourth degree burn.
Wow.
And basically, when you think about it, if you've ever experienced, let's say, some sort of a pain or some sort of an emotional sorrow or pain, and then you have to go do a task and be very busy and concentrate. Have you ever had that experience? And if you can think back and remember about it, when you were really concentrating hard on doing something else, you were unaware of that pain in that moment. Because your brain can't be everywhere at once. And so your brain is now directed to what you're focusing on.
Hmm.
But because there is a physical sensation, let's say, or an emotional sensation, when your brain is not occupied, it goes to that. Oh, yes, this really hurts. But you forget about it when you're so involved in something, because the brain can't be everywhere at once. If you have a toothache and a lion comes rushing at you, you're going to forget about the toothache. Well, part of what hypnosis can do is distract your brain from what's going on that is unpleasant, which is why I will often use guided imagery, imagining yourself at a beach, imagining yourself floating. And especially when people have pain, let's say back pain. I worked with a colleague years ago, and first I determined, do they have any fear of water? And if they don't, then I let them imagine, and I sometimes we use music in the background, using all the senses to help get them into that trance, and have them imagine floating down on a stream that will lead to a beautiful pasture, safe, and they're just floating, the sensation where they don't have to use any muscles. Every muscle can completely relaxed because you're being carried by the water. You've noticed how weightless you feel if you allow yourself to float. And they're not experiencing any back pain when they're doing that.
Hmm.
And so if you're aware that pain is a sensation somewhere else in your body, and it goes to your brain, and your brain is what is creating the suffering, you can't necessarily make it go away completely, because I have personally experienced times when it hurt so much I couldn't just do that. But I did notice that for me, if I just power through it, eventually it'll go away. And if I have a real severe enough physical problem, there are times when I will become numb, my legs will be numb, and it will be hard to keep going. And that's when I know that I can't ignore it, because it's a physical thing that has to be taken care of.
Right.
Can you talk a little bit about, so you're in the dentist chair, right? And that is just mind-blowing. And I'm sure people would want to hear, like, what does that look like? And you're not getting any kind of pain assistance. And what does the dentist say also to that?
Well, the dentists can be very leery. And I say, don't worry about it. I'm going to be fine. I have to reassure them because they're not used to people not getting a shot. But basically, there's a technique in hypnosis called an anesthetic glove. And you put the person into trance, and they imagine that they have this, it's glove anesthesia. They have this glove that wherever they touch, they will have anesthesia. They won't feel a thing. And in trance, that can help take away pain. So getting back to the dentist. So basically, I will imagine myself somewhere else, and I will, if I'm noticing a sensation, I will be aware of it. And I have to admit that everybody says I have a very high pain tolerance. People have different tolerances. So I think my tolerance starts out as seeing this as a sensation where it is. It's not a part of me, it's a sensation. And I can put my brain in another place and instead have the sensation of the water washing over me, of the breeze. And I'll ask a person what's the image they like. And, that brings up something that happened 17 years ago. I fell from a ladder. It was a couple stories up. I fell on cement, ended up being taken by ambulance to the hospital, and spent a few days in the ICU, had to learn how to walk again, couldn't feed myself when I got out. it was a big deal. Like, they didn't know if I was going to survive in the first 24 hours. And I remember that first night in the hospital. I don't know whether it was the medication or whether it was a true out-of-body experience, but I remember it was probably around 2 a.m. They finally made my husband go home. Being alone in the room with a body, looking down at this body, being aware that this body had pain, but it wasn't me. And it was this body that I couldn't move. I had no control over this body, and this body was in pain, but it wasn't me. And I even remember feeling a little resentful because I wanted to escape, get away from that body, but somehow I was tied to it. And, that was during those first hours where there was a lot of swelling in my brain, and, they didn't know what the outcome would be. I do have a permanent loss of the sense of smell. My olfactory nerve was completely damaged. But
Wow.
Going back to that, it was an experience of not personally feeling it. And so I don't think that time I intentionally put myself in trance. I'd gone into shock. That was it. I don't know what that was. But when I think about it, it was a complete escape, just like my being asleep while I was hanging on the chairlift. And that's a dramatic example. I think, Jason, you experienced a less dramatic example. You were able to go back in time, but not be there without yourself.
Yeah.
To put you in a place of comfort. I didn't have the answer, you did.
Yeah. It's like I created a new pathway. Like I changed the memory, basically.
And I believe that most people, I check the resources first, and I have them remember back to a time when they felt strong and confident and pain-free, and go back in time and connect with that part of themselves. And when you quiet the conscious mind, the subconscious can really take that stuff in much more easily. And a person has access to that core self. I mean, have you ever thought back, like, how did I ever get through that? Think back personally, you guys, when you were a teenager or a kid. How did I ever get through that? Think of a really challenging time.
Yeah.
And there's that core self that gets through that. And if a person is very religious or spiritual, then I invoke the spiritual part of them, or even the help of God, or maybe this grandmother that is no longer alive, but that was their source of strength and wisdom, and allow them to be in touch with that, because they have it in themselves. It's just gaining access to it. They have those answers. I don't.
This sounds similar to me, what I've heard from clinicians working with psychedelic therapies. I don't know how much if you've ever worked with that, or what you know about that, like if you know how that compares.
I've taken a lot of courses. I have never personally worked with it, and I have never taken a psychedelic drug. I do plan to try at some point. I've heard a lot of great stuff about it. I've read Michael Pollan's book, How to Change Your Mind, and a lot of it sounds very promising. I've really done a lot of research in it, but personally, I haven't done it yet.
So do you know enough to, I guess, speak on, just to me, having talked with clinicians who have done it and read about it, some of these things sound similar, like for example, when people have PTSD, and psychedelics can help them restore a memory in a different way. And it kind of sounds like that's a little bit of what you did with Jason.
I can't answer that from a knowledge of psychedelics.
Mm-hmm.
But what I can say is that, yes, once I feel confident that there is nothing that that person is going to experience with me that I can't handle and help them get out of, that they have the personal resources and my guidance, that if they have what's called an abreaction, a feeling of a loss of control, that they are going to be able to be safe. Then what we do is we do quiet the conscious and allow the subconscious to go back. And notice my use of the word allow. I'm not directive. That's my style is not direct. Go back to that time. I say, perhaps you'd like to allow yourself to go back to when you first experienced that feeling. Can you notice what time of day it was, where you were, to try and bring back vividly what the experience was like, so they could go back in time? Because, as I said, it's encapsulated. And the only way to process it is to go back to it, because it didn't get processed at the time, kind of like in a cocoon. But with the current resources, then they can go back and look at it and be looking at it. And what percent of you is looking at that? And what percent of you is in that experience? And that's another question I'll sometimes ask. What percent of you would you like to be in the experience? And what percent would you like to be observing it? But by going back but yet having their current resource, whether it's their grandmother or whether it's, for Jason, his own resourceful self, in many cases, it's your own self that you are now. And I'll say, do you recognize that self? Do they recognize you? What do they need from you now? And a person can go back to remembering, I needed my mom to tell me everything would be okay, or I needed whatever it is that they need. And so going back vividly, what were you smelling? What were you feeling? So perhaps that shares some of the qualities of what they do with the psychedelic therapy. I can't say I'm an expert in that, so I can talk about how EMDR and hypnosis can sometimes overlap, but I have no personal nor professional experience.
I have a thought about it.
Yeah.
I feel like this kind of, like, I process things and try to make analogies in my head when I'm listening. And I feel like you're born with your brain, which is like being given an instrument. You can learn it yourself and be good at it in some ways and bad at it in other ways. But with therapy or with somebody that's trained, they can actually teach you how to use your instrument. And psychedelics could be considered almost like using a capo to help you play chords. A capo is something you put on the fretboard to make it easier to play chords. And I feel like all of that combined,
like Dumbo's magic feather?
Like what?
Dumbo's magic feather?
Yes, except it actually does.
Okay.
Yes.
Okay.
Yes, kind of like that. And I feel like maybe psychedelics is like almost a way to, like, because I've looked into it. I don't know much about it at all, but I feel like my impression of right now is it seems like it might help you do the things that you could be just training yourself to do that might take a little longer. Like it forces you into a state, possibly almost like obviously I'm just guessing, but.
Yeah, I don't know. I know that one of my sons has really delved into it, and did have an experience with, I think it was mushrooms. I could ask him a little bit more about his personal experience. I did ask him, and for some people it's more profound than for others, and there's good and bad trips. I mean, you really have to have someone who knows what they're doing, and the correct microdosing and all of that.
I kind of want to address something that I'm interested in. If I were watching I like to think about what an audience member would be thinking. And if I were watching this before I was involved and actually had experiences with hypnosis,
Mhm.
I would have said, and this is not, no offense, I'm just telling you what I would be thinking. I'd be like, well, she fell off a ladder, she went to a hospital, she had brain, head surgery, head injuries, she's been through health situations, and I would discount everything because of that. I don't now. What is
But
there
wait a
a
minute.
reason to talk to that person, or is that person just not ready to think about it, or is like, what do you do with that person
Well,
or help them?
generally, they don't know all of that about me.
Right, that's true.
But fact is, when I was hanging from the chairlift, I had no medical history of anything.
Right,
I was just getting out of hell in the moment
right,
and going to a place that was comfortable.
right.
And mind over matter, and how much you believe that you really are in control, that you are the boss of your body to some extent.
Okay, that's
And yeah, how did you have both hips at once and keep walking? And I mean, it's how much you believe you have control over your body and how much you're willing and have the personality to push yourself.
I was
I
trying
think
to.
all of, and if I'm not a coward, and that's not to say that if you take medication, you're a coward, but for me, bravery, physical bravery is, for some reason, haven't explored it personally yet, why, is a very important part of my persona of myself. So when we were in a group skiing, and there was clearly something that was definitely pushing the envelope of our ability, I'd be the first one to go partway down the hill, so we were committed. Or if I were at a training and I did trapeze, I had to do it quickly before watching other people fail. And so part of that is a personality. And so some people are so afraid of pain that they're going to get that shot because they don't trust that they're going to be able to handle it. And that's a personality thing. And how much but that can be changed by having personal experiences of being able to control your pain. Imagine you're holding a remote control. I'm sorry, my phone, and you can dial down the amount of pain. And we practice doing that.
Yeah, like practicing your instrument.
Just like I practice having people feel anxious by breathing quickly and fast and rapid and shallowly. And after you're done doing that for 30 seconds, you no longer feel relaxed. And I teach them how just changing the cadence of your breath gives your body the signal that you can relax now.
Yeah.
And that's the start of getting somebody out of a panic attack who would otherwise escalate by breathing more quickly and allowing those what if fantasies to run out of control without taking charge immediately and saying, oh, I noticed you're here. I'm going to start by breathing slowly. And I think I'm going to attach you to a balloon and watch you float off. And kind of create.
And it sounds mystical, but it's just help. It's like, I feel like it's almost like firing chemicals in your brain by suggesting imagery. Like I always have to turn things sciencey for sure. And like, for instance, in our work, I remember one time we went to try to find my safe space or green space, I guess it's called now. I'm not sure, but and mine was I turned it into a stone gazebo with, for some reason, curtains. I don't know why I liked them, on the side of a cliff over an ocean. And I'm able to now say I've been procrastinating a phone call because I know how awful it's going to be because of emotional reasons or whatever, and I've been just putting it off. I can actually just think of that spot now, and it puts almost everything in perspective and makes me feel like I am. It almost takes away that really root feeling of I'm going to die, because I feel like I'm going to die is the root of almost every single fear. Even if you don't think it, it's there. And I feel like it makes me go, it's not a death thing, Jason. And then I feel really fine with and confident about making the call, and it never ends up being as bad.
Well, you
As I thought it
used
was.
a really important concept, and that's the cue. And the more experience you have with self-hypnosis or any hypnosis, you do have a cue. And we had some friends visiting, and she has trouble falling asleep, and she got this tape hypnosis to go to sleep. And she said as soon as she hears the person's voice, she immediately starts to fall asleep. That's a cue.
Yeah.
And yes, the more frequently you do it, the less it takes to get. The first stage is induction.
Mm-hmm.
I mean, formally, there's deepening, there's transfer ratification, and then there's emergence. But the first part is induction, and that's inducing the trance. And it takes less and less the more comfortable and experienced you are at getting into trance. And some people just do it naturally. Children, they say, quite easily do it naturally. But I didn't go into a formal induction when I was hanging from that chairlift. I just immediately got out of it down.
So how do you, for people that don't have experience with anything, and again, this is like how Jason thinking about an audience that might be totally new to any of these concepts. How do you differentiate like meditation from hypnosis?
In meditation, the goal is to get to a specific trance-like state of mind where your conscious mind is quiet. However, in meditation, there is no post-hypnotic suggestion. It's just relax.
Okay.
Whereas with hypnosis, you do get into that brainwave state, but in that state, when you're receptive, then a suggestion could be, so imagine that you are in the airport now, and you're reading a book, and you found out that your flight is delayed by 12 hours, and you're sitting in the airport. Maybe that's somebody's greatest fear. And you strike up somebody asks you a question, and you find yourself engrossed in the most fascinating conversation, that the hours just go by, and all of a sudden the flight's going to go. I mean, that's just a quick off the cuff way of responding to that. Did I answer your question?
Yeah. I mean, it sounds like the difference is one is you're just in a state of relaxation, and then the other, as you said, there's a
right. Or the post-hypnotic suggestion could be, well, go back in time to when you first felt that experience that you came here about. That feeling of you're going to die if you make that phone call. What was your first experience of that feeling of you're going to die? What was going on? And then kind of dealing with what's the origin of something, and sometimes finding the origin and then processing it, because at the time you didn't have the resources to process it, so it got put in the cocoon. But finding the origin and then going back and getting back into that experience with your current resources, which are completely there during trance, you have more resources to work through the problem. And so it's not just an experience in relaxation, it's actually processing some things that were troubling you. Like for you, Jason, you said you were more relaxed, but you also processed through some stuff that really bothered you about your childhood.
Right. It's almost like meditation helps you get to the place where you can accept hypnosis. That's what I'm hearing anyway.
Well, it gets you to this. It helps you to be more open to suggestion that normally your conscious mind would say, how can I dial down the pain with my pretend remote.
Right.
But it kind of quiets that stuff so that a person can believe more literally that this can happen.
Yeah.
And if you can have the skill to do it, you can be hanging from a chairlift and be asleep somewhere and not there.
Sounds like Jedi stuff to me, and I like it.
Yeah.
But for some people, it comes very naturally.
Yeah.
And all people fall into trance when they pass their exit on the highway or they're watching it. They kind of zone out. That's trance. But some people are just learn how to harness it and use it to their advantage.
Cool. All right. So we're at the 1:30 mark. So I'm
okay. And I just wanted to mention, yep. I kind of mentioned to my brother I was doing this, and he's very scientific like you are. And Jason and I had talked about this. He feels he has a lot to offer about what is physiologically going on with your brain under hypnosis. So I said we could do that as a separate thing because he's going to be much more technological and scientific about waves and what's happening, whereas I'm more about how you can use it and how it affects you in your life.
Oh, yeah, for sure. But I do have one more question for you.
Okay.
It's a question, and Rena, you can also, if you have one more question too. But mine is one I ask every single guest, and it's not really related to anything. And it's hypothetical. And it involves your imagination.
Okay.
So this part's easy because you're there. Imagine yourself where you are, and I wonder if that's where I came up with this was our work. Oh, anyway, but and through the door, someone that looks exactly like you, and are wearing the same clothes, except the clothes are more disheveled, or maybe there's a rip, and they look like they've been through some stuff. And it's you. And they say, I'm from the future. Come with me right now. Would you go?
Well, I'm really curious because it doesn't look like you're in a good place. So before going, I want to know why you look like
that. Yeah.
That's my reaction to that experience.
All right. That's good. I think that's very careful.
Very what?
Careful.
Yeah. I mean, why would I step into misery if I don't have to?
But you're gonna have to if that's really your future self. That's why.
Well, I guess my question is destiny or choice.
Right.
And to what degree do we have choice over our destiny?
So you'd actually be questioning why your future self would even want to come back and bother you with this.
I would just want to know how it got there to see if there are choices I could make to not get there.
Oh, that's interesting. That's a very unique answer, actually.
I will mention that in my work, I have met people who identify with their physical aches and pains. And if I look back at my history, not being able to walk for a period of time, having the back surgery and numb legs and feet, to the point where if I wanted to swim, I had to crawl into the water, which I did. And I would have to use my arms to walk upstairs. And when somebody came to the door, I couldn't stand. I had to crouch down. And then having both hips replaced, I could identify as this person who has all these things. However, I kept swimming. I kept riding my bike. I was able to ski, even though I was parking and handicapped and had to use my poles as crutches to get to the lift while my husband carried my skis. Once I was on skis, it was different motion. I was able to ski. And then when I came home, I put my ski boots on my hands and climbed upstairs on all fours.
Wow.
So I never identified with that person. I identified with that physical, strong person, which of course kept me in shape to be able to recuperate pretty well from all that stuff. And that's how I got into swimming year round. I swim in Lake Champlain until I leave in the end of October with a wetsuit, a diving hood, neoprene in my hands and feet. And I swim all winter in the ocean in Florida. Never lakes. I mean, never pools, just lakes and oceans.
Wow.
But I got into swimming as a way to, when I couldn't put weight on my body, I was weightless and still managed to enjoy my dream. And there's a really wonderful movie about a quadriplegic who lives his life experiences through his mind.
Oh, wow.
When I think of the name of it, if I think of it, I'll let you know. It's going to be one of those things where my subconscious is working on the name of it.
And I will look it up. And
The Sea Inside. It's called The Sea Inside.
Oh, okay.
And this man completely dissociates from his body trapped in a bed.
You know, sorry, that just triggered something in my head. What you just kind of described again, when you described that again, it reminds me of an acting technique that we used to basically, for lack of a better term, chill people out. So they would feel more open to the character. And I've actually used it on Mila when she was anxious. And what I would do is I would stand up and we would put our hands together and I would push on each other as hard as we possibly could. And I would say, push harder, push harder. You can do better than that. And she'd push. And I'm like, now sing happy birthday. And so she's trying to shove me over with my hands while singing happy birthday. And this person that was completely devastated a few minutes ago is now like, it's almost like our brain chemistry completely changed.
Well, you distracted her entirely. She might as well be fighting off a lion. Her brain can't be anxious.
Yeah.
And that does remind me, if we have the time, a colleague asked me to cover for her, and she had a very severely dissociative identity disorder client who she said might call. The woman called, and I'm talking to this woman, trying to calm her down. However, there are no words that can calm her because she is now in the personality of a young child. Wow. And so I started singing Michael, Row Your Boat Ashore. It was just something I came up with in the moment. She sang along with me, and she was much calmer. And I said to her, okay, I'm going to call you back. Don't answer. When your phone picks up, I am just going to sing it. And anytime you're feeling anxious, you can listen to that recording.
Nice.
And when her therapist came back, she asked her therapist to do songs with her. So what was I doing? It was clear in that moment that words were not helping her process anything because her brain was not in a state, in an adult enough or old enough state to process with words. So I came up with Michael, Row Your Boat Ashore, that kind of old, we all know that song, that's soothing, that was able to reach whatever part of her needed soothing, that words dealing as adult to adult or adult to even speaking age person to calm. And even in terms of your son, it's possible that certain music or lights or some other mode of communication are going to work better because words are not his way of communicating.
Yeah, that's true. That's definitely helped a lot doing stuff like that. Did you have anything, Rena, before we switch to the next section?
The segment with my brother.
Yeah, and Rena, you suggested that you had some possible thing you wanted to do. Did you decide whether or not you wanted to, or if you had time?
Probably not actually. So I'm on deadline I have an article that's due today that I have to and I have about 1,000 more words to write on it. So yeah, so unfortunately I do have to go tend to that. But yeah, I don't think there's anything that I could ask right now that would be a quick, I mean, I could, yeah, I would love to, learn more about hypnosis and so forth. Like I said, I've interviewed clinicians about psychedelics and like all different types of treatment, but I haven't really delved into the hypnosis bit. It's very interesting. So thank you for sharing.
Yeah. So
my pleasure.
So then we'll end this, and then if you want to go, Rena, you can, and I'll carry on with Cherie and her. What'd you say?
Brother,
right? All right, cool. Is there any? Do you want to be contacted, Cherie? Do you want any links, or do you want any way, like, for people to be like, hey, I mean, I know you're busy, so, but if not, it's cool. You don't. Not everyone does.
I have to say I'm doing a lot of my work remotely now, and unless I really know a person well, I would be hesitant to do hypnosis with them remotely. I do it, but usually when I know a person better, although it has worked with Zoom. I mean, people know my name. They could probably find me.
Yeah. Yes. Exactly. Okay, cool. And so I just want to say it to everyone, please subscribe. It's the most important thing, in my opinion, to our channel. And other than that, Patreon would be fantastic so that we can move out of our situations where we have our lives taken up by jobs that don't fulfill us emotionally. And we can start doing this, full time. And yeah, anything from Rita? Anything else?
Yeah, this was a great episode, and thank you so much.
Thank you
for sharing. It was a pleasure to meet you, and thank you to everybody for listening.
Yeah,
thank you.
Thanks a lot.
Bye-bye.